WQAD News 8, this is WQAD This Week.
Good morning. It's Sunday, July 2nd. Thank you for joining us for News 8 This Week. I'm Jon Diaz. Back in August, President Biden signed the PACT Act into law. The law is intended to help veterans suffering from illnesses tied to exposure to burn pits, Agent Orange, and other toxic substances. Already, hundreds of thousands of veterans have sought treatment under the expanded benefits. And this morning, there is some new information that could impact the benefits you get. We spoke with the Department of Veterans Affairs to understand what all of this could mean for you and your family. And joining us now is Josh Jacobs. Josh, thanks so much for taking the time this week to talk with us.
Thanks so much for having me.
Let's start. I know there's some new information that you want to get out there, but I want to back up a little bit. I know the PACT Act has now been around we're almost going on a year now. But for anyone who's not familiar with what it is, can you tell us a little bit about it?
Absolutely. The PACT Act is a historic law that expands access to millions of veterans to get health care and benefits. And it's perhaps the largest expansion in generations, if not ever. And the goal of this law is to provide health care and benefits for veterans from the Vietnam War to the Persian Gulf War to the more recent conflicts who've been impacted by toxic exposures.
You call it historic. Give us a sense of why it's so historic. It seems like it covers so much. And in some cases, it seems it's a little bit, if we're talking about Vietnam War issues, it's historic because of that as well.
Yeah, it's historic because it's allowing us for the first time to care for millions of veterans who we have otherwise been unable to provide benefits or health care to, specifically relating to their exposure to these toxic substances. So in the case of Vietnam veterans, we're now able to provide benefits for veterans who served in Vietnam, were exposed to Agent Orange, and have hypertension. Or for more recent veterans who served in Iraq, Afghanistan, or some of the other Central Command countries, if they've developed respiratory conditions or cancers, we're able to provide them benefits and healthcare specific to those conditions. And we haven't been able to do that up until this law's passage. So we anticipate that there are potentially millions of veterans and survivors who are eligible for these benefits and healthcare, and we want to make sure they know about the law and that they have access to apply for and access those earned benefits and healthcare.
How many folks so far have already filed claims? The last time we spoke with your department, it was in the hundreds of thousands. Obviously, is that number growing?
Yep, it is, and it's growing quickly. We have received almost 700,000 PACT Act claims since the law was enacted on August 10th. And that's a great start, but we think there are many more veterans and survivors who have earned these benefits, and we want to make sure we're reaching out to them and giving them the resources to file claims for these earned benefits.
Let's talk about a deadline that's coming up pretty quickly. And it's going to feel quick, even though it's several weeks away still. That veterans need to know about, and why is that deadline in particular so important?
Yeah, so we've received 700,000 PACT Act claims, but there are many more veterans who haven't filed yet. And what we're telling any veteran who hasn't filed a PACT claim is to please file by August 9th. The reason this date is so important is if you file a claim by August 9th, we have the potential to backdate that claim to the date the law was passed, or enacted rather, August 10th, 2022. And that allows us to pay you benefits going back almost a year. Now, if you file after that date, you can still be eligible for the PACT Act. It's not going away. We just won't be able to pay you the benefits going back to the earliest possible effective date. So what I would say to your listeners, if you haven't filed and you're worried about pulling together the information you need, you can simply submit what we call an intent to file. And an intent to file is a form. You just sign it and it tells us you're going to submit a claim within 1 year. It gives you that window of time to pull together your military records, any health records you need, and it preserves your earliest possible effective date.
You just brought up some of the paperwork that's needed. It could be a daunting task in any space to file a claim, right, for anyone. What has the department done to make this as easy as possible when it comes to submitting, but also like what the necessary documentation would be?
Yeah. So to submit a claim, we need two primary pieces of evidence. One, we need military records. So we need evidence that you served in one of the covered locations during one of the covered time periods. And two, we need your health records. So we need evidence of a medical diagnosis. And under the PACT Act, we can presume that your military service contributed to or caused your health condition under the PACT Act. Now, if you don't have those records, VA has a duty to assist you in finding those records, so you shouldn't worry. And we also have a number of resources to help you file your claim. One, you can go online. You can go to va.gov/PACT, and you can learn about the law. You can also file a claim online. Two, you can call us, 1-800-MY-VA-411. You can ask questions or you can ask for help. Three, you can stop at one of our 56 regional offices that are located across the country. Or four, you can work with your local county veteran service officer or your local veteran service organization like the AMVETS, American Legion, Wounded Warrior Project, and the like. And they've got great resources to help you file for free. You don't need to pay anyone to access the benefits that you've earned.
Are there any barriers to this that we need to call out right now, just so that we can identify those barriers and find ways to help veterans? Anything that might be getting in their way to doing this, or is it really just the knowledge that this now exists?
Yeah. Well, one thing I hear from veterans that I talk to periodically is they don't want to apply for benefits because they feel like it's going to take away from someone else. And what I would tell those veterans is you should absolutely apply for benefits. Not only are these benefits that you have earned, they're going to help you, help your family, and they're going to help your fellow veterans. And so as we get more information about veterans who've been impacted by toxic exposures, it gives us data, it gives us medical information we can then use to evaluate and potentially add future presumptive service conditions so that we can help other veterans moving forward.
All right, Josh, a great message to end on. Thanks so much for taking the time this week.
Yeah, thanks so much for having me. Appreciate it.